good afternoon, and welcome. Thank you all so much for joining us. This is a wonderful session today, part of our Future of Nursing Campaign for Action webinar series. I'd like to thank our speakers, Kathleen Kessler and Teresa Wehrwein, and I would like to also now turn the podium over to INQRI's co-director, Mark Pauley, who will tell us a little bit more about our speakers.
Thanks. Thank you, Heather. I'm delighted to be able to introduce this really interesting seminar with two people at Michigan State University who have been working in this area for many years, and that we're going to benefit, I'm certain, from their advice. They have also been supported most recently by the Blue Cross Plan of Michigan in this effort. The overall idea, as you know from the title, is creating partnerships to build a culture for professional growth for registered nurses, and it's linked to the Institute of Medicine's objectives in terms of providing more lifelong learning for nurses. Just a few words about our speakers, and then I'll turn it over to them. So Teresa Wehrwein is currently Associate Professor and Associate Dean for Academic and Clinical Affairs at the Michigan State University College of Nursing. In this role, she provides leadership for all the programs there. I think the baccalaureate, the master's, and the continuing education program, and the faculty clinical practice. She received her BSN from Michigan State and her MSN and PhD from Wayne State University. I also want to introduce Kathleen Kessler, who is currently the Director of Professional Partnerships in the College of Nursing at Michigan State. She was responsible there for the operations of continuing education and international programming. She's had 30 years of experience in nursing education in both colleges of nursing and agency-based positions. She earned her baccalaureate degree from Marquette University in Milwaukee, Wisconsin. I guess it's distinct from any other Marquette University, but no, that's the only one I know of, and her master's degree in nursing and administration from Madonna University. So Terry and Katie, take it away.
Thank you very much. We're pleased to be here today to share some of the things we have learned in our time together working on professional partnership and continuing education growth. Specifically, we're going to look at the objectives today, discussing lifelong learning and strategies to engage nurses, to describe specific programs developed to support career development for practicing nurses, and to explore how utilizing partnerships can leverage lifelong learning programs into development. I'm Teresa Wehrwein, and I will be presenting the first part of the conference, and then Katie will take over and discuss some of our programs as we move forward in the program. The work for workforce development, looking at the shortage of nursing and how the shortage of nursing professionals was going to increase in the beginning half of this century, began at Michigan State before the Future of Nursing report. But as we look at the Future of Nursing report and what we know about the expectations of developing high-quality, patient-centered models of care, and that nursing will have to be at the table providing direction for these models, the work we were doing with the workforce aligned with this and has allowed us to move forward in other areas as we develop our aspect of moving nurses in their careers, helping nurses transition to more and more community-based programming within their careers, and align them for the future development of their own professional goals within the nursing profession. On this slide, you see the recommendation subset, the 8 major recommendations of the Future of Nursing report. And highlighted, we have shown the one that we're really focusing on today, to ensure that nurses engage in lifelong learning. As you look at all of the recommendations, you do see that they require nurses to be lifelong learners to achieve the ability to remove scope of practice barriers by maintaining competency, or to be developing residency programs, and that's new learning that's occurring. So that in all the areas of the IOM report, continuing to learn and continuing to develop is an important part of what happens. As we look at learning, we're looking more not just at continuing education and receiving materials. Now we are looking to talk more about what are the competencies and what's the competency development we need to see in individuals so that they can perform the behaviors, the nursing care and leadership behaviors that are required to move the healthcare system forward. This is the challenge as we develop educational strategies that will support our nurses to have the knowledge, skills, and abilities required to achieve the expectations of Healthy People 2020 and beyond. What is it they're going to need to do to develop a culture of nursing where the professional will be engaged from the time they begin their career as they move forward to obtain the skills, to attain the abilities and competencies to provide the care that is needed by the clients they have in front of them, the care that will be needed for the clients that come before, and to provide the organizational and system changes so that the outcomes of healthcare can be achieved to meet the tripartite goal for healthcare, that we will have high satisfaction and cost, and the patients will have a truly great experience in care. Michigan State University College of Nursing is a leader in nursing education, and we have worked long and hard to develop our place in nursing education, practice, and research. We provide baccalaureate, advanced practice, level education, and as well as embracing the education, research, and practice missions, we look to our land-grant history as the premier or first land-grant institution in the country to have the community engagement in each of the areas that we provide through our education, research, and practice. To meet this, MSU College of Nursing has established an area of professional partnerships with a specific mission to live out that land-grant route of being engaged in the community and working with our community to develop the nursing profession. So with that, we are building partnerships with individual nurses and participants in programs to healthcare system professionals and the healthcare organizations themselves to develop new programming to move forward. We have an ongoing program of continuing education for lifelong skills that looks at programming from an individual one-day conference to the courses we will discuss today that prepare you for true career change. But we're looking at working with nurses in all stages of their career. Some of our programs focus more on younger nurses, but many of our programs look at nurses who have been in the workforce or have been registered nurses for a long period of time, knowing that these individuals need the support of their profession, need the support of their academic organizations to continue to develop their nursing skills to provide best possible patient care. In the professional partnership area, we are therefore looking to achieve these learning opportunities for nurses across their careers, to leverage resources to maximize input. Continuing education is expensive. It's expensive for nurses and it's expensive for individuals to put on within an organization. We need to find ways to bring people together to do this in a cost-effective way. That, for us, has been building and sustaining partnership models to move our resources forward. And using technology. Technology is a key, whether it's in the online courses we will be discussing, through some of our virtual series, like our grand rounds for rural hospitals that is done in a virtual manner, so that the technology allows us here in East Lansing to serve the entire state of Michigan as our community. But the goal for each partner when we come together in a program is to bring their strengths and resources so that each of us will achieve what none of us could do alone. The examples we're going to look at today are 3 case examples. One started with a local program, such as our case management conferences. The second is our RN refresher program. It started as a statewide initiative funded by a grant from the Blue Cross Blue Shield of Michigan Foundation. And finally is the Nursing for Life RN Career Transition Program that grew from the RN refresher program and was developed with the support of the PIN project from the Robert Wood Johnson Northwest Health Foundation. The case management conferences that we have here at Michigan State University were originally funded as a sideline, if you will, to a grant from the College of Human Medicine that was looking at resident education and aligning it with working with case management in the community. As that program developed, the individuals in the College of Human Medicine that were in charge of the program realized that the case managers in our state had very little access to professional development. And while their initial alignment with the College of Nursing was to obtain nursing continuing education credit, we soon understood that we needed to develop a sustainable program to meet the needs of this particular population of nurses. To keep it going after the grant support, we engaged community partners, looking for healthcare agencies, providers of services in this area, not-for-profits, and the State Department of Community Health to all come together in a collaborative planning team to develop a conference that could meet the needs of these nurses. The goal was to bring national thought leaders to our local care management providers, individuals who did not have the opportunity to go to national meetings but needed to know what was happening in their particular area of work. We also looked to have local experts, individuals from around the state who could highlight the best practices and share expertise, projects and programs that really worked that could be tried in other organizations. The collaboration continued to evolve to other disciplines with the engagement of social work and other disciplines engaged in case management, the continuation of the participation of the College of Human Medicine to their Institute for Healthcare Studies, and has now evolved to the largest conference for case managers in Michigan. We will be having our 12th conference this fall, and we have served the needs of over 3,000, possibly close to 4,000 participants in this program, looking to bring everyone together to meet the needs of a particular group in the state. The next program we'll discuss is the RN Refresher Program. And this is an online program that looks to bring the nurse back to practice, the individual who has been out of nursing, to recruit and return experienced nurses to the workforce. As many of you know who may be involved in health systems operations, nurses who've been away from the job for more than 5 years have lost some of their skills and also have not learned what's coming out in the last 5 years, and hospitals are many times hesitant to bring them back to the workforce. Refresher programs were difficult to find, and the way they were offered was difficult for many nurses to engage in. So we wanted to try something new that we could look at. This grew out of work that we had looked at with the nursing workforce shortage. In 2002, Dean Emerita Marilyn Rother from the College of Nursing and I were asked to develop a white paper. The white paper was looking at the nursing shortage. As we looked at the nursing shortage, we developed some goals within the college to increase our academic programs, to expand our enrollments that could have long-term solutions, but we also identified that there was a short-term solution to the problem. There were nurses who were not in the workforce who may want to come back, but we didn't have a good way in this state to get many of them back into nursing. And with that came the beginning of the development of a grant, which was funded by the Blue Cross Blue Shield of Michigan Foundation, to bring these nurses back to the workforce in a program that was flexible to their needs. So the RN Refresher Program was funded by a grant and piloted for 2 years. It has been tuition supported since 2005, successfully returning over 350 nurses to practice. Designed for nurses who wish to return to active clinical practice with a focus on individuals who are going to the acute care setting working with adults. It's self-paced learning and flexible time. The individuals have opportunity to have personal feedback from faculty. The faculty are available not only for online support, for grading their assignments, for talking with them by email, but spend much time on the phone with the individuals as they are planning, moving ahead for the clinical experience. The collaborative planning for clinical experience is one of the keys to the success of this program. As we've talked to our participants, the greatest fear that they have is moving back into the clinical area, and that they will be able to provide safe and high-quality patient care when they have been away for a while. The faculty member who works with them to establish their opportunity provides them with the support that they will be successful. The curriculum was developed using a conceptual model and 3 main areas of conceptual underpinning. Certainly adult learning principles coming from Noel's work, looking at how they learned. We looked at the principles of skill acquisition, the work of Patricia Benner, that these are individuals who, when they had left the workforce, had been competent providers, but now they've been away. They're moving back to novice event roles, and they have to see themselves being able to return to their level of competency in the skills area. And certainly the principles of self-efficacy, to provide them with experiences in this course through the online learning and through the clinical experience to develop the confidence that they would need to move forward as they went back to practice. I'll now turn the program over to Katie, and she will describe the specifics of this program.
Thank you, Terry. So as Terry said, we have been working with nurses who are returning to the workplace for a number of years, and the way we designed the program is using online theory modules and then this 120-hour precepted clinical practicum. The first 5, and I'll show you the modules in just a minute, but as what we worked on in this particular program is really to focus around care of the adult and with medical surgical conditions, and on what changes have occurred in nursing or updates that are going on, and also on how nurses practice primarily in the acute care setting. These are the topics of the theory modules that we have, and as you can see, the first 5 deal with sort of more general kinds of areas. All of our programs we look at, we have a module on how to learn online. Many of our students that take our programs are not that experienced in online learning, and some not that experienced with using computers. And of course, we know when they get back into the workplace, they're going to be using a lot of technology, including computers. So this kind of helps them get going. So our first module is really how to learn online. We're fortunate here at Michigan State that we have a lot of support for learning online, a 24/7 help desk, which is extremely helpful for the nurses who are taking the program. And so those are some of the resources that we bring to bear on this. And then you can see that we have modules around professional nursing roles, especially those new and emerging roles that nurses are responsible for, different nursing models and models of healthcare delivery, looking at cultural issues, and then pharmacology, and then 10 system-based modules that are organized in alliance with the book that we use. The textbook that we use for this program is the same one as our undergraduate students use in their program, so that's also very helpful because we can maximize some other resources that the college has put together. Each module has these components to it, and we use kind of an exemplar model. We use case studies. We have written assignments that are brief and targeted. We focus a lot around patient education. We also look at what resources are available out on the at various online resources to help the nurses identify those that are of quality and those that they might use for patient populations. And we have additional that are available around clinical, many interactive online resources, and other clinically related resources that they can access. Some have been developed, as I said, here at Michigan State University College of Nursing. Some are online, and some are part of the resources that are available with textbooks today, which are extremely helpful. And nurses identify what their learning needs are as adult learners, and then they spend time on those particular areas. So we don't really track the amount of time that they spend in each module, but we do give them about 1 year to complete the course. Most completed in less time than that. A key part of this program, and I'll talk about it with our other program as well, is the clinical component. And from our perspective, this is obviously a very labor-intensive part of the course because we spend a lot of time working with them to identify an appropriate clinical agency, and then we have to go through all the logistics of organizing that. But what we have found is that it is the critical component for the nurses to actually return to the nursing workforce. It's a 120-hour clinical experience. They complete it in usually a hospital in their home community with an RN preceptor and with MSU College of Nursing course faculty as supervisors and consultants in this process. And we also give them some clinical guides, although they really do set a lot of the objectives, with their preceptor. They acquire confidence in their clinical skills in this practicum. They reform a peer network. They get a real idea of what the healthcare workforce, the pace of nursing is like today, and what's the same as when they worked previously and what's different. Many have gone on to become employed in the setting where they do their clinical practicum, And our clinical partners, particularly those that we've worked with over and over, report that these nurses are very successful and have moved into a lot of different roles after they return to nursing. Another part of this program was preceptor development. We undertook this preceptor development as part of the initial project, and what we were able to do is we engaged with our health system partners to educate preceptors, knowing that not all agencies have their own preceptor development programs, so this was an unmet need that we identified. We developed a 2-day face-to-face interactive workshop that's been presented at multiple locations across Michigan, and participants are nurses who are recommended by their organizations. In the preceptor workshops, we include content on adult learning principles, very popular, talk about generational differences and issues, lots on coaching and feedback. We also talk about teaching clinical skills, which is something that we found that is not present in a lot of other preceptor programs. And also we talk about evaluation and how to collaborate with the MSU College of Nursing faculty. So this has been a real popular component of these programs. So what are our outcomes? As Terry said, we've had over 350 nurses complete the program. We have people in the program all the time because they can come in and start as they are ready and move through it at their own pace. So it's an ongoing enrollment process. But we have, for the participants, for the nurses, they are prepared to return to the nursing workforce. For our health system partners, they have access to potential staff and also to enhance the skills of their existing staff as preceptors. For us in the College of Nursing, we have a successful, sustainable program. And for our funder, the Blue Cross Blue Shield of Michigan Foundation, they have an outcome that supports what their funding priorities are. I'm now going to talk about sort of an outgrowth of that first project, which is the Nursing for Life RN Career Transition Program. When Blue Cross Blue Shield of Michigan received information about the Partners Investing in Nursing's Future program, which is, we call it obviously PIN, from Robert Wood Johnson Foundation, they actually contacted us at MSU to see if we wanted to partner on an application for the first PIN grant cycle, which reflects the fact that we had a beginning partnership already established. Probably many people are familiar with PIN, which was conceived as a collaborative initiative to address nursing issues through funding partnerships with community and regional foundations. So a national funder partnering with the regional and local foundations to advance nursing initiatives. The PIN program is now in its 6th and final cycle, and we were actually funded in the first year of the program. I'm going to talk a little bit about a PIN 5 project a little bit later on. But this program enabled us to develop a project that built sort of on our original programming and extended our partnership and expanded it to a more national level. So the Nursing for Life RN Career Transition program, the PIN program has really been very important for nursing all over the country and actually even outside the country, in that foundations and other partners who had previously not really been involved in supporting nursing issues or priorities have become involved, and larger networks have been created. And our partners for this project are on the slide. So obviously Robert Wood Johnson Foundation, who is the lead on this, the Northwest Health Foundation, who has implemented this program, our partner at Blue Cross Blue Shield of Michigan Foundation, and then we engaged community partners. We had an Office of the Chief Nurse in the state of Michigan, so that group was involved. Our Michigan Center for Nursing, which is our Michigan Nursing Workforce Center, very engaged in this program. A lot of health system partners, and also the Michigan Center for Rural Health, who has participated with us on a number of efforts, in addition to us here at MSU. And what we were trying to accomplish in this program was to focus on nurses who wanted to transition from one role to another in a community-based setting, which by all accounts is where care is moving and will continue to move. We now know that procedures that have been done in hospitals move to the ambulatory care setting, and now those ambulatory care settings, these procedures are moving all the way to the office setting. So care is really moving out into the community. Oftentimes, though, what is needed are experienced nurses who can work in these community-based settings, since practice is more independent. It requires strong assessment and problem-solving and identification skills, as well as well-developed critical thinking skills. That's a lot to ask of a novice nurse. So oftentimes these settings would like to attract the experienced nurse. So our target audience for the program is primarily nurses who were either thinking about transitioning, maybe transitioning into retirement by stepping down from a more intense job to one in a community-based setting, although those can be intense as well. But that was our target audience for the grant. The program, the original program that we developed with the PIN grant, focused on 4 settings: ambulatory care, home care, hospice palliative care, and long-term care. Because the program was recognized as a success, Blue Cross Blue Shield of Michigan Foundation funded us to add 2 additional tracks to this program, which we are currently doing. In case management and quality and safety management, those 2 focus more around the patient-centered medical home model. And so we have actually 6 components to the program. We used the same curricular model that we tested in the RN Refresher program, and we obviously needed to expand our partner networks to community practice settings. We worked a lot with the statewide organizations around these particular practice areas, and they were very helpful in helping us with focus groups and with also clinical placement sites. And we also engaged as one part, and I'll speak a little bit about this in a second, we engaged our community partners also in statewide nursing workforce planning as a part of the original PIN grant. I will also mention that we did preceptor development as a part of this grant as well, and we learned that many community-based settings, home care agencies, hospice, palliative care, all of these settings, they really oftentimes do not have formal preceptor programs. So we identified another unmet need with that particular component of the program. In this program, and I won't go into all of the topical areas, but we have core modules that everyone takes regardless of which specialty area they're going to focus on. And we identified these core areas primarily out of focus groups with the various stakeholders who helped us refine our curricular ideas. So these are the modules that are contained in the core series, which all the nurses who participate in the program take. Then this slide is an example of the module topics for our hospice and palliative care course. We always look at environment of care and then specialty modules that focus around that particular practice area. And what we did and have done to develop the content is to identify content experts who help us with what the online content will be. We use textbook support as well, and then we refine those into a consistent model of how the modules look online for the participants. Again, in the Nursing for Life program, we have a clinical practicum. This is a little bit variable depending on the course, the specialty area that the nurse is going into. But primarily for the first 4 areas, it's been an 80-hour clinical practicum, again completed in that specialty setting in the nurse's home community with an RN preceptor. And we look at the role transition of a nurse who's had a lot of experience and is moving from one role to another. And so really the clinical experience helped to prepare them to begin work as an RN in this setting. It does not take the place of an orientation process or anything like that. It really helps them just become acclimated to the setting and see how how care is delivered in their particular specialty setting. And this program was the one that the RN Career Transition Program was featured or highlighted in the Institute of Medicine report on the future of nursing as an example of lifelong learning and career transition, which we were very proud of. And it has, as far as sustainability, it is a tuition-based program, as the refresher program is. And that brings us to how our partnerships have grown and deepened as a result of our previous of the work in our previous programs. One of the things that we did in the Nursing for Life, our INQRI Transition project, was we held a statewide leader forum as part of that grant, and we invited stakeholders, nurse leaders, and other leaders in healthcare to come together to do some strategic planning around nursing workforce issues in Michigan. And the top priority that was identified out of that leader forum was the need for leadership development for nurses in all settings in our state. And so we had a framework, and we had several other priorities that are being addressed in other ways, but the leadership development component was really one of the things that people across the board said was needed. So our partners at Blue Cross Blue Shield of Michigan Foundation were interested in continuing to work on nursing workforce issues, and as a result of that, a proposal was developed for a leadership program in the PIN 5 cycle. And that project is entitled Leading Toward Tomorrow. It was funded, and as all of the original partners that were involved in the initial work that we've talked about already are still involved with some additions and with some change in who's leading those different efforts. The Michigan Center for Nursing is the lead partner on the Leading Toward Tomorrow program, and in addition to Blue Cross Blue Shield of Michigan Foundation, the Community Foundation of Southeast Michigan has become a foundation partner. And without the work of the Blue Cross, with our colleagues at Blue Cross, I don't think that would have happened, because they were the ones who were really instrumental in engaging another foundation in funding nursing workforce in nursing initiatives. Previously, the Community Foundation of Southeast Michigan does a tremendous amount of work, but they hadn't really funded or become interested in nursing issues or issues that focused around nursing, and so this is a new area for them. They have a particular interest in care of the elderly, so we have actively been working to recruit nurses to participate in the Leading Toward Tomorrow program who come out of community-based care, particularly those that care for elders, although as we told them, every part of nursing cares for elders. So that meets their goal. This program is a 6-month intensive leadership development program, and it is currently in the second year of PIN funding and in the implementation phase. And I actually serve as the project manager for this program as well. It's targeted at nurses who are either new to leadership roles or those who would like to develop further their leadership skills. So we don't have a real specific focus around that, but generally they are recommended by an organization and are sent by an organization. That's how it's worked in the pilot. A unique feature of this program is that we collaborated with our colleagues in California from the Association of California Nurse Leaders to purchase a curriculum that they had developed and had successfully implemented for several years in California. This program is developed to address the American Organization of Nurse Executive Leadership Competencies, and we also use a model that's been developed by Kuznis and Posner, who are leaders in the whole field of leadership development. What we've been able to do is adapt the California curriculum for our model, and it's enabled us to focus on implementation of the project more quickly. We had intended to have 2 cohorts go through during the grant cycle, but because the program has really been very popular, we are adding a 3rd cohort, which wasn't part of the original grant. It's designed for learning as a cohort, and the participants come from settings across the entire care curriculum. We have nurses from acute care, long-term care, hospice, ambulatory care, community mental health, and so on. And so our previous experience with Nursing for Life has really helped us to get out in a network to attract and recruit nurses from all of those settings to participate. And we think that it really adds to the richness of the experience for nurses, because they now have a network of colleagues who work in a number of different care settings. So, in summary, what does it take to build a culture of lifelong learning? What we have learned in our work here at Michigan State is that partnerships are critical to success. Partnerships require collaboration. They require sharing of expertise, which is certainly what we have become enriched by ourselves. It also enables others to step up and lead efforts, so different people lead different initiatives at different times. It helps us to align our resources with priorities and to develop programs that nurses need, that their employers need and want, and that will serve the mission of the various partnerships. So I think that brings to a close my remarks, and we certainly are open for questions. We thank you for the opportunity to share some of the work that we're doing here in Michigan.
Thank you. I have a couple of questions that have come in via the chat feature. The first one is referencing the theory module components, actually back on, I think, slide 19. One of the components provided is a disease exemplar. Can you give some clarification about what that means?
Sure. Because of the nature of learning in a module setting, what we did was for each one of the systems, say the cardiac system or respiratory system, we focus on one or two exemplars of conditions in the online component. So for heart, in the cardiac module, it's heart disease. In the respiratory module, it's pulmonary, chronic obstructive pulmonary disease, and I think pneumonia. We might have focused on two in that one. And then the readings augment all of the other aspects of that particular system. So we focus on the care of a patient as they move through what would be involved in the care of a patient that would have those conditions. Those are things that are seen very commonly in the hospital today. And we also looked at conditions where there might have been a lot of change in how they're managed over the time that a nurse might have learned about this originally. So it goes through all of the diagnostics, the nursing care, the medications, the treatments, the teaching, the transition to home, all the aspects of care. And then we use a case study that aligns with that so that they can follow those through using nursing process.
Great. I have another question that's been submitted about outside partnerships. How are you engaging hospital leadership? While educating the nursing workforce is important, it is difficult for substantial change to be integrated into daily activities without leadership buy-in.
We have been very successful at engaging chief nursing officers and nursing leadership throughout the state in this project as we've moved forward. The individuals that we have relationships with, starting at the university, that we'd had significant clinical relationships with in the education of our students who had employed our graduates. We also work with organizations where, through our other professional organization contacts, Katie and I had been involved in working with these individuals. It was very important to bring in what is in it, where's the win for the organizational partner. And that was, in the beginning, the preceptor modules. In the preceptor modules, the individuals could see where they were getting training that would be useful, not only because MSU might be sending potential employees who could be recruited if you thought they were good in the RN Refresher program, but they were getting training for their individuals who were providing the precepting for their own new employees at a higher level than they were able to provide. So we wanted very early, and that the preceptor module did that, to build in a win for them so there would be some take back that they would have that would work for their organization. And that's continued as the programs have developed up through the current project, where the hospitals are identifying people that they see they want to move forward in their careers, they see as having leadership potential. And since entry-level nursing management positions is one of the highest levels of anticipated need for nurses, the hospitals are trying to work on this, and it provides them with a venue to see who can be those people to move up in the chain.
We also worked a lot, I should say, with the Michigan Organization of Nurse Executives, which is very active in our state, and have ourselves been actively involved in that organization, and they have been very instrumental in helping us move these initiatives forward through their networks. And, we have a lot of years in nursing. I think that's another advantage. You just have the networks. We have a lot of networks developed, and so we're able to maximize those.
Networking truly is key, and staying connected with the practice networks while you are in academia is absolutely crucial. It's easy to get isolated in an academic setting and not maintain your contact in the organizational level and the community level with nurses in practice leadership positions. And to develop these kind of relationships over time, that's absolutely crucial.
Mm-hmm. In your educational models, is there any emphasis on interdisciplinary collaboration?
Yeah, we're moving a lot more into the interdisciplinary models, particularly in the newer programs, the case management, quality and safety management program. Those are focused around the patient-centered medical home, which is by its nature interdisciplinary and obviously focuses around the patient. But and in all of them, we have that interdisciplinary component of, especially out in the community-based care. But how do you work collaboratively? How do you work in an interdisciplinary model? Although I think we need to probably look at the refresher program again. You have to update these periodically to really focus around now the initiatives around interdisciplinary care, because that certainly is something they're doing, and I think we need to bring that to the forefront a little more. But in the other programs, I think we have tried to do that, and in everything now that we're looking at. In the Leading Toward Tomorrow program, we have, it's nurses who are attending, but we are looking at, who are our presenters, and are we able to look at how they're working in an interdisciplinary model. All the nurses that participate in that program do a project, which I didn't mention. It does not have to be completed by the end of the program, but it needs to be at least planned, and they have a whole component on project management, but almost every single one of those had an interdisciplinary component. So we're really seeing that, playing out in the service side and in the projects that we are learning about, and we're hoping that we're going to be able to do some publishing around some of the work that they're doing, because it's really quite extraordinary.
Wonderful, thank you. I have two more that have come in here. The first one is, what is the name of the California curriculum you mentioned?
You had to ask me that. Oh, I can see it. I can't remember it off the top of my head, but it's a program that they developed, and they've had it for about 8 years. And it's through the Association of California Nurse Leaders, ACNL. And I just can't remember the name of the program. But what I did was I actually went and attended the program myself. They do theirs over a 4-day period, so it's a shorter time frame. They've sort of adapted it over time, and then we have taken that core and then changed it and added to a particular program, which is more cohort-based and over a longer period of time. But we used a lot of the modules and the things that they have developed, and we're actually going to do a presentation at the National Nursing Workforce Center's annual conference this year around that collaboration and how that model can work. And I understand another statewide project has approached them about purchasing their curriculum as well. So it's a good way. You don't want to reinvent the wheel if you don't need to.
Absolutely.
And I will email you that, Heather, so that you get that name.
Great, that's perfect. Do any of your educational models emphasize mentorship of senior nurses to new nurse graduates?
Not specifically. When we're looking at the preceptor courses, many of the preceptor courses are senior nurses coming in and working with the people in the curriculum, and we know, and the hospitals tell us, that part of the reason individuals have been selected is because they are individuals who are engaged in the precepting and mentoring of new graduates in their hospital. But our focus have been developing preceptor courses around the content for our programs, and in our programs they are not geared to the new graduate, but people coming back into practice or changing practice. But the content in the preceptor courses has been utilized and certainly looked for by our hospital partners to provide additional training for individuals who are acting as senior preceptors.
And then the whole idea around senior nurses or maybe newly retired nurses or carving out a role as being like a sort of a mentor is being discussed. We are working on some other initiatives in our state around residency and that kind of thing. And I know that that's a role that a lot of organizations are looking at, is to help bridge that gap by having sort of this senior coach kind of a person. But our program doesn't address it specifically, although I think it's a great idea that's worthy of consideration, certainly.
Great.
Hi, this is Cheryl Schmidt in Little Rock, Arkansas. I noticed that you're trying to attract the nurse returning to practice, and I'm wondering what the job market is in Michigan, because I've noticed throughout the country a shortage of openings for new grads or grads of AD diploma programs, and I'm wondering if you don't have that problem there, and that's why you're trying to get nurses to come back after they've been out of practice.
Well, that's it's an interesting question, because I think in some areas certainly that's more true. And we don't just have nurses in Michigan taking this program. We have nurses from other states as well, and have actually had a couple of nurses who lived outside the country who took it, and then were coming back. Service. Their husbands were in the service and things. But be that as it may, in Michigan, what we're finding is that they are able to get positions because organizations seem to want people with previous experience if they can get it. And that's why a lot of times they will get they will secure a position actually in the setting where they do their clinical. So we work pretty hard with them on identifying that, not 100% at the time. And it may not be the exact position that they want, but as we tell them, as we sort of get them ready to do this, realizing that they may have to, work the off shift or not have as many hours as they wanted, or work in a particular area. But we have not had a lot of problems with them getting a position and being hired. What has become challenging in the face of the economic downturn, and certainly in Michigan we have had a severe economic downturn that is now, I must say, on the upswing, which we're happy about, but was the fact that it was a little more difficult to find the clinical placements for nurses, and that seems to be easing up some. And we're also starting to see people moving again in positions, retiring, changing jobs, being more. We saw a lot of hiring market for a while that seems to be changing. I think in other states like California, we've had a few nurses from California, and that's a more difficult market. They just have an oversupply of nurses, so it is more challenging. But the experience, in their background that they had previously, really does seem to matter as well. So I hope that answers that.
Thanks. I'm just getting more concerned every day about the shortage of jobs for the new grads.
One thing we're finding,
where do they get their first job?
Yeah.
We're finding that in Michigan that is turning around. We just actually had graduation 2 weeks ago, and this year many more of our students had jobs already offered or had been actively interviewing prior to graduation. A year and a half ago, that was not the case. Our students were having very great difficulty. So we're seeing the relaxation of the job market somewhat as our economy is beginning to turn back around in Michigan. We are seeing more people moving into retirement, which was also part of the whole flow for new graduates coming in. So while it's certainly not a great job market, we are seeing definite signs of improvement here.
All right, thank you.
Okay, this is Michael Hutton. Can you hear me now?
Mm-hmm. Can you hear me now?
Yeah. Curious to know about your ongoing measures of outcomes. Where are you engaging evaluators in your measurement work, and what specific outcome measures are you using for the project?
The evaluation component occurred in the pilot phase during the funding, and that was part of the funding that we obtained for both of these projects. And we were looking then in terms of the satisfaction of the individuals with their program, the outcomes they achieved in terms of their success in the program, and then how they did in terms of moving to the job market. We looked at the outcomes as perceived in terms of practice behaviors, both from the perspective of the individual who had completed the program and from the preceptor and early on, we were able to also get some information from the employers where they went. But the evaluation in terms of heavy, if you will, evaluator content is not able to be supported with the tuition funding, which is why starting these projects with grant funding where you can build in a strong evaluation component is so important, so you can align your course and make the revisions necessary to move it forward.
And in the Leadership Leading Toward Tomorrow program, which is currently in part of the PIN grant, our evaluation component for that looks at the satisfaction of the participants. We do some screening or some surveying of where they think their strengths are, and then we've also surveyed their supervisors as to where they think their strengths and areas of opportunity are, and then we're going to do a 6-month follow-up of both of those to see if there's been a change in or a perceived change in their skills in particular aspects of leadership. For our first cohort of that project, it ended in January, the end of January, so we're getting ready to do the 6-month follow-up with the first group. And our second cohort is in process now. We're, moving that on, and then the third one. So we should have some good data by the time we finish that. But then as the program, again, looks at a sustainability model, I don't know whether we'll be able to continue to do that or not. So I agree with Terry on the evaluation part of the grant is really helpful.
And with the PIN project for the 2 programs that were developed with the Robert Wood Johnson and Northwest Health Foundation support, they had program evaluators who were evaluating the entire project but were also aligned to specific programs so that we had individuals to provide additional consultation to the evaluation built within the grant. So we really did have strong support from the funding agency to work with their evaluators to make sure we stayed on target.
The other thing about participating in PIN was that the evaluators were really looking at the partnerships and doing an evaluation of the partnerships themselves and how all of these projects across the country, where were the strengths in partnership development. So we've really learned a lot about that component by being able to participate in PIN that we can use in other work that we're doing. So I know that's not exactly the same, question that you asked, but
it's been a great learning opportunity for us.
Well, thank you, everyone, and this is perfect. We've gone right to our time, so I thank you all so much for attending and participating in this session today. And, of course, we definitely want to thank our wonderful speakers. This is a wonderful addition to our webinar series. I did have a question about when this would be made available. We will be posting the video on INQRI's YouTube channel and then making it available not only there but on www.inqri.org. We'll also be posting some new information soon. We have a couple more sessions in our series, and we'll be posting some information soon about registering for that. So www.inqri.org for all of the information. But in the meantime, thank you again, all of you, for joining us, and thank you, Terry and Katie. This has been wonderful.
Thank you.
Thank you.